My name's Michael Foster. I'm an internal medicine pediatrics provider at Family Medicine Zeeland. I thought I'd take a minute to talk about mental health. Anxiety and depression are things that, as I was growing up, were often buried. They were kept underground and given the perfect environment to grow, and then we wonder how their roots became so pervasive. And now we live in a world where 1 in 5 adults struggles with mental health at some point in their life. 1 in 6 kids from age 6 to 17 struggle with it, let alone the kids younger than that are having those feelings of nervousness, edginess, inattention, fear, all of those things that they can't even put words to, let alone speak to their parents or their peers about. So I really want to take a moment to say that I'm excited to bring those symptoms into the light, show what they are, discuss them with folks of all ages, and really be able to expose them as something that we can talk about, that we can address, that we can treat, that we can deal with. The symptoms can be so subtle, and yet they can be so pervasive. Anything from having a loss of interest in something that you used to enjoy, to feeling nervous or on edge about a daily task that you used to be able to complete without issue, difficulties with sleep, difficulties with concentration, all the way to having thoughts of hurting yourself, hurting other people. These are all things that exist on the spectrum of mental health, and they're all things that we can happily discuss and are very, very, very common and deserve to be talked about. I think the first and best treatment is to destigmatize and to say that it's something that's okay to talk about. It's no longer something we need to push under the rug. There are therapies that exist both with counseling services and psychiatric care, as well as medications, as well as lifestyle modifications that can really provide great benefits. It all exists on a continuum, and they're all things that we can discuss. If you have any questions or concerns for yourself or for a loved one, regardless of age, race, ethnicity, gender identity, any sort of aspect of mental health care that you're concerned about, I'm happily accepting new patients, and I can't wait to hear from you.